Look at your feet right now, not tomorrow, not after work, right now. Most people only notice their feet when they hurt, a blister, swelling, maybe dry skin or a cracked heel. But after 20 years in clinical medicine, I can tell you something unsettling. Your feet often reveal disease long before your body screams for help. In 2021, a man ignored a small, dark wound near his toe for months. He thought it was just friction from tight shoes. By the time he finally saw a doctor, the tissue had already begun to die. Severe peripheral artery disease. Emergency surgery saved his life, but not his foot. What started as just a small spot ended in amputation. And here is the frightening part. His body had been warning him for years. Cold feet, slow-growing toenails, night cramps, numbness. Signals he ignored because nobody taught him what they meant. The truth is simple. Your feet are the furthest point from your heart. When circulation weakens, nerves fail, or blood sugar rises, the damage often appears there first. Not in your chest, not in your blood tests, in your feet, and most people never look. Subscribe to Vital Life and hit like. We are exposing the health signals your doctor may never mention during a rushed appointment. Every subscriber helps us keep making these videos. Now let me show you what your feet may already be trying to tell you. First, temperature. Healthy feet are usually warm. Not hot, not ice cold. Warm. If your feet constantly feel freezing, even in a warm room, your circulation may already be declining. Blood vessels narrow. Oxygen delivery drops. Tissues begin starving slowly over years. One of the most common causes is peripheral artery disease. Fatty plaque builds inside arteries, reducing blood flow to the legs and feet. Smokers, diabetics, and adults over 50 are especially at risk. And here is what most people miss. Peripheral artery disease is not just a leg problem. It dramatically increases the risk of heart attack and stroke. Your feet are not the problem. They are the warning sign. Now look at your toenails. Are they thick, yellow, crumbly, growing slowly? Most people assume fungus. Sometimes they are right. But fungal infections thrive when circulation and immunity are weak. In other words, the fungus is often the consequence, not the real problem. Diabetes is one of the biggest hidden drivers. High blood sugar damages tiny blood vessels and nerves. The feet lose sensation. Small injuries go unnoticed. A tiny cut becomes an ulcer. An ulcer becomes infection. Infection becomes gangrene. Every year, hundreds of thousands of amputations begin exactly this way. Not with pain, not with drama, with neglect. Now press gently on the nail of your big toe until it turns pale. Release it. The pink color should return in under 2 seconds. This is called capillary refill time. Emergency physicians use it constantly because it gives immediate information about circulation. More than 2 seconds. Your blood flow may be compromised. 5 seconds of testing, potentially life-saving information. Now examine the skin. Dry, cracked heels may look harmless, but severe dryness often reflects dehydration, hypothyroidism, or impaired circulation. Deep cracks create open doors for bacteria. In diabetics, those tiny openings can become dangerous infections surprisingly fast. Pay attention to color. Blue or purple toes suggest oxygen deprivation. Pale skin can signal anemia or poor blood flow. Redness with heat may indicate infection or inflammation. Dark black tissue is a medical emergency. Never wait on black discoloration, ever. Now let us talk about numbness. If your feet burn, tingle, or feel asleep at night, your nerves may already be under attack. The most common cause is diabetic neuropathy. But vitamin B12 deficiency, alcohol abuse, and spinal nerve compression can produce similar symptoms. Nerve damage often develops silently for years before weakness appears. Again, the feet speak first. Cramps are another signal people dismiss. Occasional cramps happen. Constant nighttime cramping is different. Low magnesium, dehydration, poor circulation, and nerve dysfunction can all contribute. Many people simply stretch and move on without asking why the body keeps sounding the alarm. And now, one of the most overlooked signs of all, loss of hair on the toes and lower legs. Hair follicles require oxygen-rich blood. When circulation declines, the hair disappears first. Smooth, shiny skin, combined with cold feet and weak pulses, is a classic vascular warning sign. Your body prioritizes survival. Hair is optional. Blood flow to vital organs comes first. The feet lose out quietly. Now look between the toes. Fungal infections love dark, moist spaces. Peeling skin, itching, or a sour odor are common early signs. Left untreated, fungus spreads into nails and broken skin. For healthy people, it is unpleasant. For diabetics or people with vascular disease, it can become dangerous. Small infections become big infections when healing is impaired. One more thing most people never think about: shoes. Tight shoes slowly deform the structure of the foot. Bunions, ingrown nails, nerve compression, chronic inflammation. Fashion often wins over function until walking itself becomes painful. Your feet carry you for decades. Destroying them for appearance is an expensive trade. So here is the system I want you to follow. Once a week, 5 minutes. Good lighting. Check. Skin color, temperature, toenails, cracks or wounds, swelling, sensation, capillary refill, areas of pain. Photograph anything changing. Because the earlier you catch disease, the more options you have. Your feet are not just body parts you hide in socks. They are biological sensors, early warning systems, messengers. And if you learn to read them, they may tell you something important long before a hospital ever does. If this helped you, send it to someone over 50, someone diabetic, someone who ignores symptoms and says, "I'm fine." Sometimes the body whispers before it screams, and sometimes those whispers begin at your feet.